Welcome everyone, I'm Dr. Jackman. I'm the Medical Director for Renew Vitality. We're going to talk today about how to go about injecting yourself with Sermorelin. Overcome the fear of injecting yourself. It's a lot simpler than it seems, guys. Sermorelin comes in as a powder, which you can see on the close-up, and then we mix it with water. Remember, we're going to use one of the dosages or one of the concentrations here, but obviously the actual concentration that you will use for yourself will depend on your protocol and your physician, okay? We're just doing this for demonstration purposes. So as always, we have a drawing syringe, which is a much larger syringe with a much larger needle, and then we have a small insulin syringe. Sermorelin will be injected subcutaneously, meaning the tissue right under your skin. It's a very small needle. This does not go in a human, okay, as you're about to see. So the preparation is always standardized, right? So uncap it. Now we have our water, we have our Sermorelin. So we're gonna use one of the protocols which calls for 4.5 milliliters of sterile water mixed into the Sermorelin, okay? So always you take a little alcohol swab and clean it. Doesn't have to be a 3-hour process. Just pass it through just to make sure it's clean, let it air dry for a minute, which we're doing while we talk. This is going to be our drawing needle and our drawing syringe. Remember, always make sure that these are sterile, right? If you don't know if it's been out of a package, don't use it. Use another one, okay? So here we go. Sermorelin is here. It's our powder. We're going to draw 4.5. This is a 10 milliliter syringe, so we're going to get a little less than half of it. Give yourself a tiny little bit of air at the tip. Flip over your vial, and here we go. So this is water, okay? So I'm going to turn it so you guys could see the measurement. Remember the top of the marker, right? So the very top of the plunger is going to give us the dose, and we're going to go to 4.5 for illustration purposes, right? So we're basically there. We come out, and then we've already sterilized the top of this, so you go right back at it. Smooth, remember it's water, so it goes in fairly quickly. It's not a race, as I always tell people, so do take a few seconds, especially when you're early in the process and trying to get the hang of it, right, which is what we're doing here. So we're going through it. It'll mix fairly quickly. The powder itself will mix fairly quickly, right? So you don't have to shake it for an excessive period of time. But recap this carefully. You can poke yourself, and then very gently you're going to agitate it. You can see it's basically already all dissolved. It's not crystallized. And then here we are. Now to inject it, remember this is a subcutaneous injection, so it's very superficial, right under the skin. The best way to go about this is with insulin needles and syringes. These syringes are great because they come already with little needle at the tip and something to protect it here, right? So you don't have to uncap anything. We're gonna draw, in this case, right, again, just for illustration purposes, we're gonna draw 0.3 mLs. But remember, the dose matters. The dose depends on your protocol. All right, so we're ready to inject. We have our trusty insulin needle and syringe. We've drawn to 0.3 milliliters, which comes out to fairly standard dose of 600 micrograms of Sermorelin. But remember to individualize this based on your protocol, okay? And then we're ready to inject it. The injection works as follows, right? We're gonna inject it most of the time subcutaneous tissue. The easier access is over the lower portion of the abdomen. As a very basic rule of thumb, 2 to 3 inches away from your belly button. So if I was gonna inject myself right here on camera, I would be either here or here. The insulin needles and syringes are made in such a way that you really can't get it wrong. You can't go too deep, just because the length of the needle itself, as you can see on the close-up, you're gonna hold it so that you basically come at yourself perpendicular, right? So it goes in nice and smooth. You go in, you push it relatively quick. It's a very small amount of material. You basically don't even feel this needle go through. Make sure that you wipe the skin before, alcohol swab as always, pull out if you have to. If you see a drop of blood, re-swab it so that the site is nice and clean. You don't necessarily have to cover it just because of how small the needle is. And that's all we have for a Sermorelin injection, guys.